Welcome to Solving Healthcare. I'm Kwadwo Kyeremanteng. I'm an ICU and palliative care physician here in Ottawa and the founder of Resource Optimization Network. We are on a mission to transform healthcare in Canada. I'm going to talk with physicians, nurses, administrators, patients and their families because inefficiencies, overwork, and overcrowding affects us all. I believe it's time for a better healthcare system that's more cost-effective, dignified, and just for everyone involved. Limiting care for those that are unvaccinated. This is a chatter I'm hearing on Twitter and so forth, and I got to tell you, I hate it. I hate it. I think it's wrong. I think it's creating mistrust. I think it's divisive. I think it's creating more tribalism. And to me, this is the last thing we need. Okay. We need to be clear in our messaging, as we talked about before, why vaccines work. They prevent you from landing in hospital and ICU and dying. That's the magic of the vaccines. Okay. And this is what our messaging needs to be, clear and concise. And for us to put value judgments on people based on the lifestyle decisions, choosing not to get vaccinated. Yeah, no, I want you to be vaccinated, but I also don't want you to smoke. I also don't want you to use IV drug use. And despite that, when you come into my ICU, I treat you the same. We hustle. We do what we can to serve and get you through your illness. And to think that we would do anything less because of your vaccine status is atrocious. It is absolutely atrocious. And it would be extremely shameful to even think that's a consideration within our society. Like, we're better than this. We are better than this, especially in light that, when it comes to some of these things, it's systemic concerns. The fact that we haven't always had clear messaging in terms of the effectiveness of our vaccines. You have an 18-year-old whose parents said don't get the vaccine because they're fearful that it's ineffective, and they come in as a result of that COVID, and we're going to say, you know what, you made a bad decision, and we're not going to give you all the access to care that you need. Not right. That's not why I got into this game. That's not why I got into medicine. All right. So yes, it's a totally understandable to be frustrated, but it is not right to be even thinking this is a reasonable option. Thanks so much.